morning and welcome to Medical Dialogues, your daily dose of health and medical news. I am Dr. Nandita Mohan and here are the latest reports from the world of medicine. Proton MR spectroscopy could improve the diagnosis and treatment of multiple sclerosis. Multiple sclerosis is a disease affecting the central nervous system that mainly manifests itself as lesions primarily affecting the brain. As yet, there is no cure for multiple sclerosis as such, but it can be effectively treated. The early diagnosis is critical to the prognosis, with highly detailed imaging techniques playing a major role. Although conventional MRI can detect brain lesions, the scientists are still researching newer methods to detect the changes at an earlier microscopic or even biochemical stage. The method, known as the Proton MR spectroscopy, has been identified as a promising tool. The journal Radiology reports a new MRI technique that has been used that could pave the way to quicker assessment of disease activity in multiple sclerosis. This new neuroimaging technique could become a standard imaging tool for initial diagnosis and even for monitoring disease activity and the treatment in multiple sclerosis patients. Natural supplements not necessarily safe may adversely affect the heart in athletes. Nutritional supplements are commonly viewed as risk-free substances that are known to improve a performance of anybody. Some nutritional supplements, including various plant and natural extracts, may pose a serious health risk and athletes may even risk contravening the anti-doping rules. Athletes who use supplements have no knowledge regarding their effects on the sport's performance and the overall health aspect. Mostly they get their advice from coaches, fellow athletes, family members and even friends. A new study finds that nutritional supplements taken to boost the athletic performance are not necessarily safe and may even be risky for the heart. The study published in the European Journal of Preventive Cardiology, where it is seen that athletes are always personally responsible for any substances they consume. Ignorance is not accepted as an excuse in relation to a positive doping test. In those with an established cardiovascular disease, a sports physician or a sports cardiologist should always be consulted prior to using any performance aid or supplement. CPAP significantly reduces the tracheal intubation risk in COVID-19 patients with respiratory failure. COVID-19 management still hangs a threat despite many trials and measures. In a new study published in the Journal of the American Medical Association, it was found that an initial strategy of continuous positive airway pressure, that is the CPAP procedure, significantly reduced the risk of tracheal intubation or mortality compared to conventional oxygen therapy in patients with acute hypoxic respiratory failure caused by COVID-19. But there was no significant difference between an initial strategy of the high-flow nasal oxygen and the conventional oxygen therapy. The objective was to see if the continuous positive airway pressure or the high-flow nasal oxygen improves the clinical outcomes in hospitalized patients with COVID-19 related acute hypoxemic respiratory failure as compared to the standard oxygen therapy. Ginger supplementation reduces fasting blood sugar and blood pressure in type 2 diabetes. Ginger has been a part of our spices since ages and also known as a non-toxic spice has been applied widely among herbal medicines for various conditions including different chronic diseases as well. Now, previous studies have greatly investigated the anti-inflammatory effects of ginger. Some studies have demonstrated the positive effects of ginger supplementation on metabolic profile in patients specifically with type 2 diabetes. However, the results have been conflicting. In the study appearing in the journal Complementary Therapies in the Medicine, ginger supplementation in patients with type 2 diabetes mellitus led to a significant reduction in fasting blood sugar, systolic as well as diastolic blood pressure. So ginger supplementation is the way. Probiotics and micronutrients during pregnancy reduce the preterm birth. Better metabolic and nutritional health during preconception is hypothesized to reduce the preterm birth and also promote gestational normoglycemia, but there is little evidence that supports the improved outcomes with nutritional supplementation starting preconception. Supplementation with probiotics, myoinositol and micronutrients in pregnancy and during preconception period does not improve the gestational blood sugar but may reduce the preterm birth as per a recent study. The findings findings are published in the Diabetes Care Journal, where supplementation with myo-inositol, probiotics as well as micronutrients pre-consumption and in pregnancy did not lower the gestational glycemia but did reduce the preterm birth. That's all for today. Stay safe.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.